Hello, I'm Sarah Rajes from the Clinical Department at NIDEK. I'm going to show you a little bit about the AFC-330. To turn the system on, turn the computer on and wait for it to completely boot up. Second, turn the AFC-330 on the right side of the base. Once the device is fully booted, here are all the buttons on the screen. First, we have the shutdown button. The AFC-330 has an embedded computer and must always be shut down by this button and not by the switch unless told to by the computer. The second button down is the parameter settings. This is where we can go and change our fixation modes. Third button down is to turn the auto shot on and off. Underneath that, we have the auto and manual switch. Simply by pressing manual, you can disable all of the auto functions in one touch. Underneath that, we have all our automatic settings. On the left, we have the auto tracker or auto alignment. Next to that, we have the auto anterior to posterior observation view jump. Besides that, we have the auto focus. To the right of that, we have all our image types. We have Fundus Photography, stereo pairs, panorama montage, and anterior segment. Next to that, we have our flash settings. The flash settings vary between 1 and 17 and will all depend on the patient's eye color, skin color, and hair color. Above that, we have our low light photography. By enabling this, you will lower the flash by several notches and increase the ISO. This will allow you to take a quality photo with less flash for the patient. Above that is our small pupil. The small pupil can be set to automatically go on and off as the camera measures that the pupil is 4 millimeters or smaller, or the operator can simply press the small pupil button and override. In the center of the screen, we have our pupil measure. The solid green is 4.0. That is your preferred pupil size. The interrupted green is 3.3, and that is your minimal pupil size. To the right and left on the top of the screen, we have our right and left eye markers. The camera will detect which eye it is on. In addition to having auto alignment, there are auto alignment markers that will appear as the operator is moving the camera towards the patient. Green lines will indicate that the operator is too far from the patient and to move forward. Purple lines indicate you're too close and you need to move back. Yellow line means you're absolutely perfect. Red arrows pointing away and towards the user indicate that you need to move the camera in that direction. In addition, you will also find red arrows that will be on the right and left sides of the screen, indicating that you need to move the camera either to the right or to the left. Yellow arrows will indicate that you need to move the chin rest either up or down. Fixation targets will be listed on the screen. By going into the parameter settings, you can change whether you want 3 points, 7 points, or a customized screen. When you've selected 2 or 7 points, they will be listed here on the screen. The operator can simply press their finger on the point that they'd like to capture. The default position is posterior pole. The gray bar on the top of the screen is the patient list. By pressing on that, you will access the list of names or enter a new patient. On the joystick panel, on the bottom left, you will find the chin adjustments. The chin rest is motorized. Above that, you will find the infrared light adjustment. The infrared light adjustment is helpful when focusing on the patient's retina. To the right of that, you will find the fine focus wheel. The button in the center is the manual toggle switch. This will manually move the observation view from the outside of the eye to the inside. To the right of that, we have the brake lock button. In the center, you have the joystick. By spinning it right and left, you will move the camera up and down. Moving the joystick right and left will move the camera right and left. When going from right to left eyes, swing the entire camera from side to side. The button in the center is to manually capture an image. To enter a new patient into the AFC-330, from the main LCD screen, press the gray bar to pull up the image list. Select the new icon. Enter the patient ID by tapping on the entry field and press Enter. Enter the last name and first name by tapping on the entry field, and when done, press Enter. Middle name is optional. Enter the sex of the patient as male, female, or not specified. Enter the date of birth by clicking on the left side of the entry field. First, enter the year of birth and press Enter. Second, enter the month of birth and press Enter. Third, enter the day of birth and press Enter. The optional fields are middle name, comment, history, and race. When done, press the capture icon. The main screen will appear. Double-check the patient's information is correct and proceed with your image. It is important to have the patient lined up properly before starting to take the image. First, check the objective lens for any debris. If the lens is dirty, you will have a smudge that will appear in all of your images. Secondly, wipe the head and chin rest with the cleanser. Adjust the table height according to the patient. Have the patient place their chin in the rest and forehead pressed firmly against the band. Place the operator's right hand on the joystick and left hand on the left side of the base. Using the buttons on the joystick panel, adjust chin rest height so the lateral canthus is lined up with the notches on the headrest. Confirm the patient is comfortable. Have the patient cover their opposite eye with their hand. This will help them better fixate on the target. Turn the room lights completely out before capturing any image. Fundus images are captured at the default fixation target position, which is the posterior pole. The posterior pole includes both the optic nerve and the macula. Before taking the image, it is important to inform the patient what they are going to expect during the test. Instruct the patient they will see a green blinking target appearing as the camera comes closer to them. It will appear to be doubled and off-center. Reassure the patient this is normal and to continue to look at the fixation target. Also, this is a good time to inform them of the few seconds it will take to complete the image and that the instrument will not touch or puff air into their eye. They will experience a flash as the image is captured. After you've entered in the new patient and they are appearing on the screen, select the Fundus icon. This is the default image type, and you will only need to choose this if prior you were taking a different type of image. Place the pupil markers over the white reflected dots and slowly push instrument towards the patient. At this point, your alignment markers will appear. Again, green meaning get closer and purple meaning pull back. Confirm the patient sees the target and instruct them to open wide and try not to move or blink. Have patient lift their brows to open wider if needed. Let the camera's automatic features take over. Their observation view will switch from the outside to the inside of the eye. The camera will automatically capture the image, or the operator can override and press the button on the joystick to capture. After the image is captured, have the patient close their eyes until the operator is ready to capture the fellow eye. While the patient's eyes are closed, press the green circle to accept and save the image, or the red X to delete and retake image. If the image is accepted, pull the camera all the way back to the operator and swing the camera to the other eye. The camera will remain in the patient's demographics for the following eye. Have the patient cover their first eye and proceed to capture the image. If the image is accepted, select the person icon to return to the main screen without patient information. If additional images are needed to be captured, select the capture icon to return to the main screen while remaining in the same patient's account. Occasionally, the camera will indicate there's a deviation in focus. The amount of focus deviation is displayed on the center of the focusing rod with green or purple lines. The operator has the option to press the capture button on the joystick and capture, or use the fine focus. Green and purple lines will indicate how much to turn the fine focus wheel. Turn the wheel until the green or purple lines become one. After adjustment, the camera will automatically capture. Stereo images are two separate images captured at a true 3-degree angle. First, enter in the patient's demographics. Second, select the stereo icon. Align patient and have them cover their opposite eye to better see the green fixation. Have the patient open wide while not blinking or moving. The camera's automatic functions will take over and the image will be captured. If needed, the operator can press the capture button on the joystick to override and capture the image. Place the pupil markers over the white reflected dots and slowly push instrument towards the patient. At this point, your alignment markers will appear. Again, green meaning get closer, and purple meaning pull back. After capturing stereo images, the operator will need to process the images using the NIDEK software program. First, double-click on your patient. Your stereo images will be labeled in the bottom left corner. Select both images. Select Image Wizard and select Stereo. Your images will then drop side by side. Hover your cursor in the center of the optic nerve. Left click to increase or right click to decrease. When done, select the blue arrow to crop out the images. You may then click and drag your images closer together. When done, select Save. Select Yes, and select Return to go back to your image list. Click anywhere in the light gray area to deselect those two images. Double-click on your stereo pair. To view these images in 3D, you will need your optional stereo viewer. Panorama images can be taken in various combinations. The operator can use the preset Standard, Advanced, Panorama internal fixation templates, or the optional external fixation. Also, the panorama setting is customizable. When the panorama setting is selected, the camera will automatically move the internal fixation to the next point after the image is captured. It is not mandatory to capture all preset points. The operator can override the camera and touch the desired point to capture next. The captured images can be viewed separately or automatically stitched together, creating a montage using the NIDEK software program. Enter patient demographics. Then select Panorama icon. Select Parameter Settings. Select desired fixation template. Align patient and have them cover their opposite eye. Move the camera towards the patient and instruct them to look directly at the flashing target. Have the patient open wide while not moving or blinking. The camera's automatic functions will take over and the image will be captured. If needed, the operator can press the capture button on the joystick to override and capture the image. After capturing, have the patient close their eyes until the operator is ready. While the patient's eyes are closed, press the green circle to accept and save image, or press the red X to delete and retake. If the image is accepted, the camera will automatically move the internal fixation to the number 2 point. If the image is deleted, the camera will remain on number 1 point. Do not pull the camera back in between images. By leaving the camera in the same position, the operator is in perfect position for another image. After capturing panorama images, the operator can create a montage using the NIDEK software program. First, double-click on your patient. Highlight 2 or more images to create your montage. Select Image Wizard and select Panorama. Select the Auto Image Alignment button. When done, select Save. Select Yes. Select Return to exit to the image list. Tap anywhere on the light gray area to deselect your 2 images. Double-click on your montage to see it larger. Press back to return to the image list, and back again to return to the main screen. Peripheral imaging is similar to panoramic imaging in that one can capture images beyond the 45-degree posterior pole. The operator will need to capture this type of image for the pathology out in the peripheral retina. The ordering physician may let the operator know where to look, for example, superior temporal, and others may just indicate something is out in the periphery. The operator will need to search the retina for pathology to capture. Certain pathologies stand right out and others do not. Inform the patient that a series of images will be taken. It is not mandatory to dilate patients prior to peripheral imaging. However, the larger the pupil, the further one can capture out in the retina. The operator can use one of the preset fixation templates or the optional external fixation. The operator can use all 7 points or manually tap on desired points. Align patient and have them cover their opposite eye. Move the camera towards the patient and instruct them to look directly at the flashing target. Have the patient open wide while not blinking or moving. The camera's automatic features will take over and the image will be captured. If needed, the operator can press the capture button on the joystick to override and capture the image. After the image is captured, have patient close their eyes until the operator is ready. While the patient's eyes are closed, press the green circle to accept and save image, or press the red X to delete and retake image. If the image is accepted, select another point. Do not pull the camera back in between images. By leaving the camera in the same position, the operator is in perfect position for another image. To capture external images of the eye, first place the forehead spacer on the headrest for extra workroom. Have the patient place their chin on the rest and press their forehead gently on the spacer. Inform the patient that their fixation target is not in view and to look straight ahead. Press the external icon on the touchscreen. The camera will prompt the user to enable the compensation lens. On the right side of the device, pull the compensation lever all the way out until it stops. If needed, remind the patient where to look. Slowly move the camera towards the patient until the image on the observation screen is in focus. Press the capture button to take image. Press the green circle to save image, or press the red X to delete and retake image. If the image is saved, press the capture button to return to the main screen. The AFC-330 has an internal computer and must be shut down through the screen. Do not use the switch on the side until indicated by the screen. First, press the shutdown button. Then select yes when prompted. Turn the power off by the switch after the AFC signals you to do so. Lastly, shut down the computer. The objective lens is where the patient looks into while the image is being captured. After time, debris collects on the lens and must be cleaned properly. If left on a lens, artifacts will appear on all images. Dust will appear as little dots out in the periphery. Smudges appear as white or gray smears on the images. The lens should be checked before every patient and cleaned as needed. To clean the objective lens, have the following supplies: flashlight or pen light, a microfiber cloth that is not being used to clean glasses, lens cleaning solution, and blower. To clean the lens, first turn on the AFC. Wait for unit to completely boot up. Then pull the lever out on the left side of the camera. A window will appear. Select yes. Reduce the infrared lights to minimum and press OK. Shine flashlight onto objective lens. Using the blower, remove any loose debris. Wrap the clean microfiber cloth around your finger and rub lens in a circular motion. To clean the very edge of the objective lens, place the cloth completely into the opening. Once done, shine the light on the objective lens again to see if you removed all the debris. If debris still remains, spray the lens cleaner onto the microfiber cloth and rub lens in a circular motion. It is common to have streaking on the lens after using cleaner. Use a dry area of the cloth to remove streaks. It may be necessary to repeat these steps several times to clean oily and hard to remove debris. When done, press the objective lens cleaning lever on the side of the AFC to its original position.